What's the #1 treatment for peritoneal mesothelioma? If you're looking for a simple answer, I need to say this right from the start, and you're going to hear me say it again and again. I am not a physician. This isn't medical advice, and there isn't one single treatment that works best for everyone. The treatment that's best for you depends entirely on your physical condition, your genetics, the extent of your disease, and your individual circumstances. What I can tell you is this: there's one treatment approach that has revolutionized outcomes for peritoneal mesothelioma patients, and it has turned a diagnosis that was once considered rapidly fatal into one where many patients are living 5, 10, even 15 years after treatment. The treatment is called cytoreductive surgery combined with HIPEC, heated intraperitoneal chemotherapy. Hi, I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. And today, I want to walk you through what the current evidence shows about the most effective peritoneal mesothelioma treatment. More importantly, I want to help you understand how to determine which approach might be right for you. Before I dive into the specifics, I'm going to say it again. I'm not a doctor. Nothing I say in this video is medical advice. The information I'm sharing is based on published clinical trials, medical guidelines, and decades of research. But only your oncologist, ideally a specialist who focuses on peritoneal mesothelioma, can determine which treatment is appropriate for your specific situation. Every patient is different, and what works brilliantly for one person might not be the right choice for another. With that said, let's talk about cytoreductive surgery with HIPEC, because this combination has fundamentally changed the landscape of peritoneal mesothelioma treatment. To understand why this approach is so effective, you need to understand what each component is and does. Cytoreductive surgery is also called peritonectomy. It's an aggressive surgical procedure where a surgeon removes all visible cancerous tissue from the abdominal cavity. It is not a simple operation. It can take 6 to 8 hours or even longer. The surgeon may remove parts of the peritoneum, which is the lining of the abdomen, and in some cases may need to remove portions of organs that have been infiltrated by tumors. The goal is complete removal of every visible trace of cancer. The challenge is that even when a skilled surgeon removes all visible tumors, microscopic cancer cells can be left behind. These tiny cells are invisible to the naked eye, and they can cause the cancer to return. That's where HIPEC comes in. HIPEC stands for heated intraperitoneal chemotherapy. Immediately after the surgeon completes the cytoreductive surgery, while the patient is still under anesthesia, they circulate heated chemotherapy drugs throughout the patient's abdominal cavity. The drugs are heated to about 108 degrees Fahrenheit, which is hot enough to kill cancer cells, which begin to die at this temperature, but not so hot that it damages healthy tissue, which can tolerate temperatures up to about 110 degrees. Why does heating the chemotherapy make it more effective? The heat increases the penetration of the drugs into tissue, and it helps kill cancer cells directly through heat damage. It also allows doctors to use higher, more concentrated doses of the chemotherapy than would be safe with systemic treatment. The drugs circulate through the abdomen for about 90 minutes to 2 hours, bathing every surface and reaching those microscopic cancer cells that surgery did not remove. Now, to be clear, this is not a treatment that every peritoneal mesothelioma patient can receive. Not everyone is a candidate for cytoreductive surgery with HIPEC. You need to be healthy enough to withstand major abdominal surgery that can last 6 to 10 hours. If you have significant heart disease, lung disease, or other serious health conditions, surgery might be too risky for you. If your cancer has spread outside the abdominal cavity to your lungs, for instance, this localized treatment will not be effective. And if you have too many tumors throughout your abdomen, complete cytoreduction might not be possible. But for patients who are candidates, the results get really exciting. The outcomes are actually remarkable. Multiple studies have shown median survival times of 4 to 5 years with cytoreductive surgery and HIPEC. Some studies report even better results. One study of 29 peritoneal mesothelioma patients who underwent this treatment found that nearly 3/4 of them lived longer than 5 years. Think about that. 5-year survival rates of nearly 75% in a cancer that was once accepted as being fatal within months of diagnosis. Now, I want to take a moment here and just remind everyone, if you're finding this information helpful, please hit the like and subscribe buttons. It really helps us get our videos seen by as many people as possible. And if there's a topic you'd like to see covered or a question you'd like answered in a future video, let me know in the comments section below. Also, make sure to watch until the end of this video, where I'll tell you exactly how you can access help and resources if you or someone you love has been diagnosed with peritoneal mesothelioma. Now let me tell you about the other treatment options. Cytoreductive surgery with HIPEC is the most established and effective treatment for peritoneal mesothelioma, but it's not the only choice, and in some cases, it's not the right one. Let me walk you through the alternatives. Systemic chemotherapy, which is traditional intravenous chemotherapy, is an option for patients who aren't candidates for surgery. The standard combination is pemetrexed with cisplatin or carboplatin, the same exact drugs that are used to treat pleural mesothelioma. While systemic chemotherapy can help control the disease and extend survival, it's generally not as effective as the surgical approach for peritoneal mesothelioma. The response rates are lower and the survival times are shorter. But for patients who can't undergo surgery, it is an important option. Immunotherapy is an emerging protocol for peritoneal mesothelioma. At MD Anderson Cancer Center, researchers conducted a clinical trial using a combination of 2 drugs. I always have a hard time pronouncing them, so forgive me if and when I mess them up. They are atezolizumab and bevacizumab. I wish they'd give them easier names. This was a phase 2 trial, and the results were encouraging. There was a positive response in 40% of participants, and the treatment did extend survival time. The trial also, importantly, proved that the combination was safe for peritoneal mesothelioma patients. Once again, and just so we're clear, I am not a physician and this is not medical advice. But this is important. Immunotherapy for peritoneal mesothelioma is still being studied. It's not yet as well established as it is for pleural mesothelioma. The dual immunotherapy combination of ipilimumab and nivolumab that's now standard for pleural disease hasn't been as extensively tested in peritoneal patients. If you're interested in immunotherapy, talk to your doctor about whether you might be eligible for a clinical trial. There are also patients who receive what's called NIPEC, that's normothermic intraperitoneal chemotherapy. It's done after cytoreductive surgery and HIPEC. It's chemotherapy, it's given on an outpatient basis, and it goes directly into the abdomen, but at body temperature. It's not heated, and it's administered over a longer period of time as maintenance therapy. Some studies have shown that adding long-term NIPEC after surgery and HIPEC can further extend survival times. Now, here's something I want to emphasize. It goes beyond just medical facts. When you're facing peritoneal mesothelioma, choosing a treatment isn't just a medical decision. It's a deeply personal one that affects every aspect of your life. Yes, Of course, you need to talk to your doctor. You need to understand the medical facts, the survival statistics, the recovery process, and the potential complications. But that's not enough. In the face of a serious diagnosis like peritoneal mesothelioma, you should take the time to go beyond speaking to your doctor when considering your options. Discuss the benefits and downsides of each treatment with the people who matter most to you. Talk to your spouse or partner about what this surgery and its recovery would mean for your family. A surgery like cytoreductive surgery with HIPEC requires a hospital stay of 7 to 10 days, and complete recovery can take several months. Talk to your children if they're old enough to understand. Talk to your closest friends who know you best and can help you think through what aligns with your values and your life circumstances. If you're a person of faith, talk to your clergy about how your spiritual beliefs might inform your decision. And consider talking to other peritoneal mesothelioma patients who've undergone this treatment themselves. Hearing their firsthand experiences can give you insight that no medical journal can. Most importantly, think about your goals and priorities. Are you primarily focused on maximizing your survival time, even if it means undergoing an extremely aggressive surgery with a lengthy recovery? The data shows that cytoreductive surgery with HIPEC offers the best chance at long-term survival. But it's also the most intensive treatment option. Are you prioritizing quality of life and time with family in the near future? Are you comfortable with the risks of a major surgery, which can include infection, bleeding, bowel complications, and other serious issues? Do you have the support system you need for the recovery period? These aren't questions your doctor can answer for you. These are questions only you can answer, ideally with input from the people who love you and know you best. The number one treatment for you is the one that aligns with your medical situation, your physical condition, and your personal values and goals. There is no shame in choosing a less aggressive approach if that's what feels right for your life. There's also no shame in fighting as hard as you possibly can for every minute you can get. Both choices are valid. Both choices are brave. Your oncologist should support whatever decision you make and help you achieve your goals, whatever they are. If you feel pressured toward a particular treatment without your values and priorities being heard and respected, it's a sign you might need a second opinion or a different treatment team. Now, just to recap, the most current evidence shows that for peritoneal mesothelioma patients who are healthy enough for major surgery, who have disease that's confined to the abdominal cavity, and who can undergo complete or near complete cytoreduction, the combination of cytoreductive surgery with HIPEC offers the best chance at long-term survival. For patients who aren't candidates for this aggressive surgery, systemic chemotherapy remains an important option. Immunotherapy is showing promise in clinical trials, and emerging treatments continue to be developed and tested. Which solution becomes your number one treatment depends entirely on your pathology, your overall health, the extent of your disease, and most importantly, your personal goals and priorities. The only way to find the number one treatment for you is to be evaluated by a peritoneal mesothelioma specialist, ideally at a major cancer center that has experience treating peritoneal mesothelioma and can perform cytoreductive surgery with HIPEC if you're a candidate. Those are the people that can help you understand all your options so you can make a decision that reflects both the medical evidence and your personal values. You deserve a treatment plan that honors both your medical needs and what matters most to you in your life. If you or someone you love has been diagnosed with peritoneal mesothelioma, visit mesothelioma.net and fill out our form. You'll get a free information packet that contains comprehensive medical and legal information. You can also call us at 1-800-692-8608 or use the live chat feature on the website. One way or another, you'll work directly with one of our patient advocates who can help connect you with specialized treatment centers that have experience with cytoreductive surgery and HIPEC. This is a rare disease and you need specialists who treat it regularly. As for me, remember to post any questions you have below. I'll see you next time.